Good morning all and welcome to the JCU Careers Fairs Day for 2021. You're with the amazing Townsville Hospital and Health Service. You would have seen on the JCU portal the profile about Townsville Hospital and Health Service. Today we're going to have 3 sessions that will repeat themselves. We'll have medical, nursing and allied health. Those sessions will run for approximately 30 minutes. Within the session, we'll have an introduction from each of those teams for 10 minutes. There'll be a 10-minute session from JCU graduates, and then we'll have a 10-minute question and answer session. So if we need more question and answer session time, we'll run that repeat later in the day. So if you come away from the morning sessions and think, I didn't remember to ask that question, we'll have those sessions again. So my name is Kylie Dunn. I'm one of the recruitment officers at the hospital. Sandra Pappas is also a facilitator here today. We're just going to give you a quick overview. So Townsville Hospital and Health Service covers approximately 149,500 square kilometres. We have 20 facilities within that area, and we range from locations from as far northwest as Richmond, as south as Home Hill, and we have 8 clinical facilities within, or we deliver clinical services to 8 locations within that area. Welcome, enjoy the day, and our first presenters today will be Andrea and Michelle. They are from JCU Regional Training Hub, and enjoy the day. Thank you.
Don't be silly. Here's Kim apologising for technological problems, yet she gave us the best update. I was thrilled listening to that story and then forgot to unmute myself when it was my turn. So you can see the stories that they give, and I think the grad nurses will be very imperative in that information. Remember, we're not sure, we can't see anyone asking for questions at this stage. And it might just be because it's the virtual element. When we actually go to the face-to-face JCU days, we've usually got, 10 deep all day and lots of questions coming through. So if there's a technical problem here that you are trying to actually ask a question and can't come through, please just let us know by the chat option. So remember, don't forget that the nursing group will be back again from 12:30 to 1. 12 to 12:30. Bad, did not, sorry. So 12 to 12:30, don't come in at 1, they'll be gone by then. So remember, make sure you go and speak to all of the nurses going through at the moment. Get them to join online. Really, this is your day. We are just facilitators hoping to answer your questions, and you've got uninterrupted time with these skilled clinicians who actually do this from day to day. Our next one up will be our group from Allied Health. So stay online if you're interested, if you've got a friend or a girlfriend or a brother, sister, mother who may want a career change and looking at an allied health career change or changing into an allied health role, stay on board and we'll get those lovely people talking to you. We're just going to go back to talking a little bit again about getting those documentation ready. So remember, when we're doing and you're going to go and apply for a role, we've said to you there are actual portals. So we've got the RMO campaign, which is a yearly campaign, which is a central process for junior doctors coming through hospital-based training. We've also got the nursing graduate portal. We've got, and the lovely Michelle Watson, not Jane Watson, Michelle Watson, who is up next. That's terrible. She will talk to you as an overview of if there is allied health portals. And we've also spoken about some of those roles within allied health will be an advertising recruitment process for smart jobs and careers. So we keep going back to that. Remember, you don't have to register with Smart Jobs and Careers now to have a look at jobs. just type in Smart Jobs Careers, go and search. There are disciplines you can actually search under. There's wage brackets you can search under, and have a look at what the role is. There'll be a role description attached. There'll be 2 additional documents, which is one for information for applicants, and there's also preparation for candidates. So we can't hype on that as we keep going back and hyping on that information about being prepared, making sure your documentation is current. It's certified by a justice of the peace. Remember, through that recruitment pathway, it may take some time. If you're going to have a driver's license that's expired, make sure you go and get another copy, a current copy certified. The documents we prefer are in coloured format. We can read them clearly. We need to be able to see your photo. We need to know your details, your date of birth, your address, everything like that. So please make sure that they're up to date. Your resume is up to date. It's in a clear, concise format. We need to make sure that you've spoken with your referees to let them know and ask them, are they willing to be a referee for you? Their contact details are correct. So that is, planning is so great through this process, because at times it can feel a long journey, but it really isn't. By being prepared, it won't be a difficult journey for you. Any information that you're seeking back about that recruitment process, please don't ring recruitment. Your contact will be the person in your role description. So it's imperative that you keep that role description, and that gives you an overview of the job. The ad will only give you a small snip of what that role is. The role description is something that you read through. If you've got additional questions post reading that role description, you can then contact that contact person. So updates through that recruitment process, again, will go back to that contact person. And as I said to you, Townsville Hospital and Health Services is a growing field. We do have expansion plans, and that will be, it always will be. Health is a growing field. So jump on the Townsville Hospital and Health Service webpage, have a look at updates. There'll be things around allied health, nursing and medical. Remember, if you want to follow our social media platforms, it's a really great thing to do, because there'll be stories around there about what it is in, there's a different week with health all the time. So it might be Social Workers Day was yesterday or week. There was a highlight on that on the news, and it would be on our Facebook page. So usually what appears on the news will be linked back to our Facebook page. We have Twitter, LinkedIn and Instagram as well. And we would encourage you to follow us and keep updated on that information. So without further ado, we're having some technical difficulties at the moment because our IT guru has stepped out of the room. We're just not going to do the mute and change over. So the next person will be the wonderful Michelle Watson, not Jane Watson. Michelle will give you an overview of allied health. Remember, she will give that information. There'll be some fantastic grads again to give their story, and there'll be some questions and answers at the end. So please be proactive in this. It is your day. We're only going to be as good as how interactive you are with us. So with further ado, here's Michelle. Thank you.
Hi, my name's Michelle Watson and I'm the Director of Occupational Therapy here at Townsville Hospital. And obviously occupational therapy is only one of several allied health disciplines that we have here at the hospital. The main ones that I have information about today are physiotherapy, occupational therapy, obviously, speech pathology, social work and psychology. They're kind of our key allied health disciplines, and there's a few different things from a recruitment or an onboarding perspective or a graduate program that are slightly different for each of those disciplines that I'll cover off on. And then I have two lovely graduates here with me today, one from occupational therapy, Lucy, and one from speech pathology. So that will be fantastic to hear their experience around what they have actually experienced as being a graduate here at Townsville. So firstly, I wanted to start a bit with why come and work for us and why you would want to work for Townsville Hospital and Health Service over going and working somewhere else. Certainly, there's a great opportunity to be part of a supportive environment that actually provides that supervision and professional development opportunities as core clinical components of your employment. There are certainly a range of roles and clinical settings that you will get exposure to in any of the allied health disciplines that you work in. And that opportunity to be part of that broader multidisciplinary team where, you know, you're working side by side with the nurses and the doctors and the Aboriginal health officers. Like, you know, there are so many different components of that multidisciplinary team that you'll have the opportunity to work with. A lot of the disciplines actually have specific clinical education officers, and so they can actually provide that additional support to new graduates in the workplace. So as you transition into the workplace as a new graduate, those clinical educators are actually there to provide you with support for that process and support to your supervisors as well. And in addition to that discipline-specific support, there's actually an allied health graduate education, new grad education program that happens within Townsville as well, where all the new graduates get together. It has a very multidisciplinary focus, so you can get to learn what your peers are doing from other disciplines. So, you know, it's very focused on all disciplines, not just discipline specific. And it is that peer support as well for any new graduate, whether they be from physio or OT or speech or social work. You can support each other in that journey from student to being a clinician. So just a bit of information about some of the different recruitment processes. Now, both physio and speech pathology have a centralised process that happens at a statewide level. So both of those disciplines, specific for new grad positions, will have a recruitment process that generally information is sent out to the universities. So you'll actually get that through your student email. It's sent directly like to the physio schools and the speech schools around, you know, where are the actual links to apply for those positions, as well as those dedicated new graduate positions. There are obviously also HP3 opportunities that happen throughout the health service as well that new graduates can apply for and are certainly employed within. For occupational therapy, social work and psychology, we don't have that centralised process. So particularly for occupational therapy, we have one dedicated new graduate position here at Townsville University Hospital, and so that goes out through Smart Jobs. And I know that you know, Smart Jobs has been mentioned, and certainly in any recruitment or trying to get into Queensland Health, Smart Jobs is definitely your friend. That's where we advertise all of our vacancies. So for the OT position, it's generally a 12-month contract. A lot of new graduate positions will be 12-month contract positions. And generally that then means you're here for a 12-month learning opportunity. At the end of that, certainly there is opportunity to extend and stay if there are other vacancies. What else can I say? Occupational therapy as well as has a statewide education process for a program for the discipline as well. So they top up anything that's local and allied health with a OT education program that happens on a monthly basis. Social work has actually just launched a 2-year new graduate program as well within their education. So they actually have that support as well for clinicians up to 2 years out. Psychology has a range of different support that they can provide. And depending on whether you're an undergraduate or you're postgraduate, they certainly have those placements available. Recently, they've had an intern program for graduates to assist with that additional experience so that you can get the registration through. And certainly we work in a range of different, they work in a range of different areas. I guess a couple of key points that I just wanted to finish on, and I'm not even sure how long I've been talking for because this doesn't exactly tell me. But so some of the key points for any of our programs, for any of our positions that you're applying for, they will actually go out via Smart Jobs. So just making sure that you are, you know where Smart Jobs, how to find that, just Google it, it does come up. Preparation, so making sure there are a couple of disciplines where you actually have to be registered before we can employ you. So making sure that you're applying for your registration in a, you know, when at the time when you can, making sure your CV's up to date, that you've got all that evidence around your immunisations and qualifications, and certainly if you didn't hear Kylie talking before, just making sure that you research the position that you're applying for. So the role description will actually contain a whole heap of information around the position. It will also have the contact person that you can ring to talk to about, you know, to get that extra detail around what does that position involve. You know, are you going to get supervision? Are you going to get professional development? You can ask all those additional questions from that contact person, find out which exact areas that you're going to be working in. Role descriptions can be quite bland in their information and quite generic, so it is worth contacting that person and just having that conversation around, you know, what are the intricacies of that role and, you know, what's it going to be like. You can get a bit of a vibe around, you know, what's the team like, what's the experience going to be like. So certainly research the position that you're applying for. If no one has any questions.
Sorry, I do.
Oh, no. Hello, Claire.
Hi. So you were talking about the graduate job opportunities.
Yes.
About what time of year were they advertised for the following year?
Yeah, for which discipline are you talking about?
Occupational therapy.
Yeah, so occupational therapy, ours normally comes out around October. Because it is a shorter process. The centralised processes for, particularly for physio, apparently the information comes out about mid-year. So those processes, because they're bigger, take longer. For our position here at Townsville, because we only have one position, so it's usually about October that the ad comes out. We will also notify the universities to let them know that it's out, just in case people have missed it. But yeah, generally October, and then we're looking for a mid to late January start date for that position. Yeah.
Okay, thank you.
Would that be similar for psychology?
It would be probably similar for psychology. Yeah. Yeah. So a lot of the positions that are advertised outside of a centralised process are kind of happening towards, because we want people to, we're very aware that, you know, graduates finish later in the year, so there's no point advertising something in the middle of the year because people actually haven't even finished courses and that kind of thing. So we will advertise towards the end of the year so that we can have people start in January, particularly when we are also aware that registration takes time. Like I know for occupational therapy, our graduates aren't usually registered till around Christmas Day. The last couple of years it's been, you know, that's the time when registrations come through. So we're aware of those kind of things and time our adverts around knowing that kind of thing. So it will be towards the end of the year that you would see positions being advertised for new graduates.
You're also talking about like various psychology roles or like, you know, activities basically. Could you talk a little bit more about that?
Yeah, so certainly there's a couple of different, Vidula's the director of psychology here, and she is certainly, she's provided me with some information around, like there's certainly an intern program for new graduates to kind of bridge that, the 2 years that some psychology degrees have to do before they can be registered, if that makes sense. And there's a register program. So for people doing their masters, there's a registrar program for those as well.
And that's inclusive of like supervision and all that sort of stuff?
Yes. Yep. So certainly, supervision, professional development, that's certainly, I think that's one of the benefits of working within Queensland Health is that, you know, those things are fairly core standard, you know, things that are provided to anyone within our workforce.
Okay, thank you.
No worries. So if there aren't any further questions, I'm going to get our lovely new graduates to come and come and swap places. So as I said, we have Lucy from occupational therapy and we have Morgan from speech pathology. Are we going to do them one at a time, or are they both going to come and sit here? One at a time. Okay. Lucy's up first by the look of this.
So we're going to have some feedback. I'll just, what we'll do too is, I think it was Jacob. Jacob, if you've got any additional questions that you want, send it through in the chat for us. If there's specifics, we can always make contact with the discipline head to see if they can give you some information back. Because Michelle was phenomenal to give her time today for us. We really appreciate that. And she's given us lots of great knowledge. And the allied health pathway here today has only been for the love of Michelle actually helping us and organising the grads and getting that additional information. So if you've got additional questions, please let us know. So with further ado, we're going to go to Lucy. We're going to go to Lucy, and we just might need to run over there and unmute her. Hold on.
Hi everyone, my name's Lucy. One of the occupational therapists here at Townsville Hospital. I'm just going to share my experience of how it's been. I've been here for just over a year. And look, overall, I've felt very well supported as a new graduate OT at Townsville Hospital. I found that as a new graduate, I have access to a lot of invaluable support and resources, which so far has made my experience working as a clinician here really enjoyable, essentially. So regarding what this support and what these resources look like, I have weekly supervision with a senior clinician where I can discuss what's going on with my clinical caseload, how I'm going with prioritizing my caseload and workload, determine what goals I'm working towards for career planning and progression, as well as discuss some professional development opportunities like what courses are available and workshops, and how these are going to support to achieve my goals. So also every week we have in-service where there's a presentation on a particular topic such as aged care or equipment, cognition, rehab, those sort of things, with the focus on building knowledge in those particular areas. And once a month, one of those presentations is actually a new grad video conference presentation where all the new grad OTs dial in via Microsoft Teams. And the presentations are really focused on supporting new grad clinicians and transitioning into practice. So once a month, we also have new grad community of practice where all the new grad OTs within the Townsville Hospital and Health Service meet up with the clinical education support officers. And I found this really good. It's a really nice and safe space to discuss any difficulties I'm experiencing or concerns I'm having. And these topics that we discuss focus on professional development, how to make the most out of supervision, self-care, managing conflict of team relationships, and all those sort of things. I found a really good opportunity to seek advice from my fellow new grad, peers and colleagues, as well as give the opportunity to provide my own tips and strategies that I found to be useful. And I found it just normalized a lot of the feelings and struggles I was experiencing in my first year of practice, which I said there are definitely some, challenging moments to be expected. And there's also an allied health new graduate program where all the new grads from the various disciplines meet together on a monthly basis. And that was just a really good way to network and also just learn about the other disciplines and what they do. And so my first 6 months working was at subacute unit, which is a rehab-based unit. So, which has a really big multidisciplinary approach. So I found that really useful to learn about what everyone else does, essentially. And yeah, so as you can probably tell, there's, you know, you get a lot of support, and I found it to be all extremely helpful. And yeah, I'm really enjoying working here at the moment. So yeah. Do we ask questions now or later?
Let's ask some questions now.
So if anyone's got any questions, please feel free to ask some questions now. I know the other grad nurse that we had came through talked about, you know, she had a diverse role before she actually, or diverse work experience before she actually became a nurse. Why did she become a nurse? So maybe it might be that we ask, you know, why did this lovely lady become a OT?
Look, I don't want to give too much generic answer, but look, I knew I wanted to work in health, and for a while I wasn't sure what area, but my mum had some friends who were occupational therapists, and I had to sit down with them, and they explained to me what the role involves, and straight away I was pretty interested. I said, there's an ongoing joke, you don't really know what OTs do until you have involvement with them, but straight away, studying it and then working in it, I'm so glad I did it, because I found it very rewarding, and there's a lot of learning on the job, and you just get a great experience in a hospital setting, because you get exposed to just so many different areas and caseloads, and because that is that rotational structure to it, you just get that wide variety of experience, which is amazing.
I think what you're probably feeding is hearing that message is the support that you get through that program. And you're very lucky you've got the director here today, Michelle. And you can see that, they're passionate about the role that they work in. They're supportive. The whole feedback of that story was support, 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 and that is what you want. So for our clients, really what we're trying to do is we've got managers trying to make sure that they're successful through that pathway, and that you continue to have a long and rewarding career with us. And there's a wide variety of career opportunities within that. So if there's no additional questions, we're going to jump through to our next grad speech pathologist. Thanks. Don't forget to answer those questions. Questions.
Yes. Hello, everyone. My name is Morgan, and I'm a new grad speech pathologist here at the hospital. So I went to uni at JCU, so I kind of know a little bit about what the process is like for an allied health student there. I've been working here for about 3 months now, so I'm still quite new, and it is pretty funny to still be called a speech pathologist, finally. So pretty much why I wanted to apply to the Townsville Hospital was because, I live here, my family's here, and, it's a great starting point. So, and I think also I applied here because I applied here, but I also applied at Brisbane, where there is a recognised kind of new grad position, whereas the position here is a HP3. And I applied through Smart Jobs. I did all the processes there. And the reason why I chose Townsville over somewhere like Brisbane was just the fact that because it's a HP3 role, we do get a lot of different experiences. So you're not limited to what you can and can't do as a new grad here. So the opportunities are almost endless, really. So the opportunities that we can have as new grads at the Townsville Hospital include, upskilling in things like video fluoros and going into somewhere like pediatrics, which is usually quite a specialised area that takes a while to get into. Usually they'll start you off somewhere that's nice and easy. So I'm currently down doing geriatrics at the moment, and I'm also one of 3 new grads. So the other 2 are in rehab spaces like the rehab ward and the subacute unit. And as part of, obviously, because I'm one of 3 new grads, we are very lucky that we're going to have the opportunity to have micro rotations between the 3 of us. So even though we're only going to be here for 8 months by the time we finish that, we're going to have, we're going to be upskilled in 3 different wards that are all very different with very different presentations. So I think that's definitely something that I didn't know was going to happen, but I'm very, very lucky. I think that is happening. In terms of supervision, like Lucy touched on, there's a huge range of supervision here, especially specifically for speech pathology. I do get at least 1 supervision session a week with a very knowledgeable clinician. So it's one of our seniors. And 1 a week, as per SPA, you're supposed to have at least 1 a fortnight, 1 supervision session a fortnight as a new grad speech pathologist. So already there, the Townsville Hospital is surpassing that. And I think what's also lucky about that is that you're not limited to just the 1 session. So you can pop your head in and you can ask questions to anyone in the team. It doesn't have to be your supervisor. You can ask questions to other HP3s and other areas of the hospital, as much or as little as you think you need to. In terms of the supervision sessions that we have, it's very similar to the OT. So we get to talk about PD opportunities, self-care, you know, reducing burnout, and also any clinical questions we do have, because obviously you're a new grad and you're not expected to know everything. So if something does come up that you are unsure of, you have someone there to help you through it regardless. Yeah, so I think it's quite special, and you do make really good relationships with your supervisors in that way. We also are a part of the allied health education sessions, so they happen once a month, and they're multidisciplinary with other new grads. And I think that's also really good because obviously at JCU, they do try to integrate like multidisciplinary classes and placements and things like that as much as they can. But I think when you come and you work in a place, it's also very different. So it's good because you do have those interactions with other new grads in the MDT. You do learn about what other people do specifically for different areas of the hospital. And you also just become familiar, and you know a few different faces around. So you are, you know, more likely to put your hand up in an MDT because you know that person. The last thing that I wanted to touch on was kind of just placements. So I was very, very lucky that I got a placement over at the subacute care unit in my final year. And I just want to say, like, if you do have the option of putting down a preference, I don't err away from putting down Townsville. I know in speech pathology, the course, a lot of people are very excited about going out to places like Mount Isa and, you know, going very rural or going to Brisbane. But when you think about it, if you're one of those people that are looking for a job in Townsville, it's probably good to put the hospital down as one of your preferences. You know, get your face known, your name known, everyone knows who you are, and then it makes it really quite easy to just slide into a job here. And also, you know, just the interview process is a little bit chiller because you know everyone that's in there. And yeah, I think that's all I have to say for today.
Now, remember, if you've got any questions, please unmute, and we'll just give you some time to ask some questions. Did you know Speech Pathology Week is the 22nd to the 28th of August?
Today, it's today. Today is actually Swallowing Awareness Day, everybody.
Hang on, we'll just mention that again.
Today is Swallowing Awareness Day for everyone, if you wanted to know.
See, in the Hospital Health Service, Townsville Hospital Health Service, we celebrate days and we celebrate weeks. There's always something we're celebrating. So remember, if you've got no questions, please be assured that the session will be run again for Allied Health this afternoon from 12:30 to 1. Please go and promote it with your other Allied Health grads who are going through. As I said, we keep saying that today is your day. We're here to give you as much information you can, and you've got undivided attention of grads who've been through that pathway and discipline heads as well. So remember, again, we'll be running another session for Allied Health again at 12:30 to 1, and we'd like to thank the 2 grads, Lily and Morgan, for their time today. And also their managers and supervisors who understand how important it is to provide time for them to give these sessions. So thank you again, ladies. Running forward now today, I know we keep hyping on about the smart jobs and careers. As I said, jump in, have a look, make sure your documents are up to date. And just remember, Townsville Hospital Health Service facilitates a wide area. So we keep saying that it's a great locations. We've got 8 locations we cover within that 149,500 square kilometres area. And we go as far inland as Richmond, to as far south as Home Hill, Magnetic Island, Ingham, Tewenden, Charters Towers, and Ayr, as well as Townsville Hospital site and Kerwin, and other sites within Townsville are all areas that we cover. So get as many questions as you possibly can come through. If there's additional information you want, as I said, follow the social media platforms to keep updated. If you see a story on the local news, you know it will be linked to our Facebook page. We did a dance challenge that went around the world. The emergency department, where I had a dance off against other emergency departments within Queensland Health, and it's great to see that across the state. So whilst we're a very busy tertiary referral hospital, we also have an interpersonal requirement there too, and try and make times fun by these days that we've said about the celebration of OT week, social worker week this week. There would have been a story that you would have seen on the news with our director, Julie Watson. So, you know, and as you walk through the main entrance of the hospital, you'll actually see in that main corridor what the week is that we're celebrating, as well as our phenomenal board. There are photos there that you can see, you know, who are our leaders in our organisation, as well as our executive team. So the next group that's going to come on again will be the medical group again. They will provide some information around the pathways, and remember that we've got the 2 representatives are from JCU Regional Training Hub, the lovely Andrea and Michelle. So we're hoping that we'll have some medical questions for them. There'll be a video presentation, and really they're open for questions around pathways or anything that's interesting to you. So they'll be on in the next few minutes. I'm just going to open it up again to questions if anyone's got some questions. If you want discipline-specific questions, we find that you're kept up to date from our understanding quite well with your clinical placements, and the discipline heads have a close contact with JCU and those career facilitators. So you will be kept up to date with the information there, but if you've got a specific question, please feel free to either type it, or when I unmute, come back and give me some questions that we can pass on. So we're going to talk about a portal that we keep talking about around smart jobs and careers. The grad program will not link through that portal. You'll be kept up to date with the grad program. The linkage with the JCU and the Townsville Hospital are very close. There'll be updates around that information. If you feel that you may miss out, make sure that you're talking to your clinical facilitators for those dates. But remember, we keep talking about preparation. Preparation is imperative. We want you to make sure your resume is up to date. It's in a clear and concise format. You've spoken to your referees and made sure that they would be available during that time, and that their contact details are the most current. So what we'll do now is we will talk about the Smart Jobs and Careers website, which we keep talking about for advertising to find other roles outside of the grad portal, which is a centralised process. Group that we've got coming through will be our allied health group. We will have Michelle Watson, who is our Director of Occupational Therapy, and we have 2 grads, JCU grads, who've come through the program, and they're going to talk about their pathways, their experiences, why they actually chose that specific discipline that they're actually studying at the moment. So before that, I know the two people who are still online have heard me talk about this multiple times. Michelle will talk about some, they have a centralised portal around recruitment, but for other positions, we actually advertise on Smart Jobs and Careers. So minimum requirement for us for clinical, advertising clinical vacancies is Smart Jobs and Careers. So if you're not already registered, please register. You don't actually have to register to search for jobs. So you can search for nursing jobs at the moment. It's as easy as typing in Smart Jobs and Careers. And what we do is, there it is. We've searched up in a Google. We just click on Smart Jobs and Careers. Then you'll come up, your search has come through. We hit Smart Jobs and Careers just down below. Do that. Yeah, I'll do that. We click on Smart Jobs and Careers. What you do is you don't actually have to click into your job search. You might want to write, so you might write registered nurses. What we say is when you're doing your search parameters, try and make them as big as you can to get a bit of an idea of what your search engine looks like, and then go back and refine those search parameters. So we would probably always search under Townsville, because that's the site we want you to come and work for. So we would put Townsville region as our selection. Our keyword might be, because we're going into allied health, let's have a look at occupational therapy. There may be no jobs here at the moment. It'd be good if I could learn to type. There may be no jobs in the moment because no one wants to leave us. We're such a great organisation. We don't have any current vacancies. And we'll just scroll down the page. Our occupational group would be medical. It's usually health, and it's allied health and clinical. And there, click on that. And then we would go down to the bottom of the page and click the search button. That will bring up currently any roles that are currently being advertised. And we've got one. We've got an occupational therapy in our clinical talent pool. So all you need to do is click on that little hyperlink there. It will take you in. It will show you the role description. It will give an overview of the position. There'll be documents about information for applicants, and there'll be another document about preparation for candidates. So if you haven't already had a look, go and have a look. If you haven't already registered, register. You must register to set up a job alert. So what we'll do now is we'll now start our second allied health presentation with the wonderful Michelle Watson. Thank you. And what we might do is actually get Michelle to give a bit of an overview of why she chose occupational therapy as a discipline for her.
Gee, I've been put on the spot then. So I'm Michelle. I'm the Director of Occupational Therapy. Why did I choose occupational therapy as a profession? Gee, that is like so far back in my history. But I think I always wanted to be in a profession that helped people, and occupational therapy was one of those areas where I had the ability to do that, and also had the ability, it's been a career that's allowed me to travel the world, which has been fantastic. So a bit of a presentation, or a few things about why you might want to come and work with allied health here at Townsville University Hospital. In particular, I think it's a fantastic supportive environment where you will get that program of supervision, professional development. You get the chance to work in such a variety of roles and clinical areas across the spectrum within the hospital. Obviously, as a tertiary facility, we actually have a lot of complicated cases that come to us from other regions. So you get that experience of working in a hospital that has that range and breadth of experience. You get the opportunity to work as part of a multidisciplinary team, which is fantastic. So not only with your other allied health counterparts, but with your nursing and medical counterparts, Indigenous health officers. Like, there's a wide range of people within that multidisciplinary team. Some of the other benefits of working here at Townsville Hospital is that we also have discipline-specific clinical educators. So they're actually employed to help new graduates transition into the workplace. So they're there to support you. Some of the disciplines actually have statewide education programs that are further scaffold in that support network. So occupational therapy has a statewide program. Social work has a statewide program that looks at providing that education and peer support to the graduates across the state. Locally, we also have an allied health education program as well, where we get all the new graduates together, and certainly Janet and Morgan will be able to provide a bit more information about what that experience has been like for them. But it's that peer environment, but also where you can learn from your other allied health colleagues about what does the physio do, what does the OT do, how do you fit into that multidisciplinary team, and how do you build on what you've learned at uni about what the roles actually are. So I guess that's a bit about, you know, some of those opportunities you'll get if you come and work for us in our wonderful organisation. Some of, I guess, so if you do want to come and work for us, there's a few different things to take into consideration. There's a couple of disciplines that have a centralised recruitment process. Now, they are physiotherapy and speech pathology. So they have a centralised recruitment program for their dedicated new graduate positions. Now, sometimes we don't necessarily have those here at Townsville, but across the state, they do a big centralised process. Normally starts to come out about mid-year, where all those hospitals that have new graduate positions will participate in that process. But I guess that's not the only way into the organisation. Like, there are other HP3 opportunities, and certainly speech pathology locally doesn't have a dedicated new graduate position, but you're able to apply for HP3 vacancies that are here and still get that support that a new graduate gets, even though you're not in a dedicated new graduate position. For occupational therapy, we have one dedicated new graduate position here at Townsville Hospital, and that's not a centralised process. So generally we'll advertise that around October, looking for someone to commence in kind of mid to late January, once you've had all those requirements met, such as your registration and those kind of things have come through. So that's certainly a different process to the centralised process, and goes out via smart jobs, which Kylie was mentioning before. What else do I need to say? Social work as well doesn't have any dedicated new graduate positions, so they're another profession where you need to be looking at smart jobs and applying for those HP3 vacancies. For psychology, there's a couple of different ways into psychology, depending on whether you've done an undergraduate or you're doing masters. So for the undergraduates, there's an internship program to help you bridge that gap for you to become a registered psychologist. For the master's program, there's actually a register program that is in place for those graduates to apply for, to come into the workplace. And certainly if there's any, psychology is obviously not my background, and we can certainly get you some more information regarding those. I guess overall, some key points that I just wanted to highlight, just again around the smart jobs and really staying aware of, you know, keeping an eye out or registering an EOI so you know when positions are coming available, but also other than that, being prepared. And when a position is advertised, you know, use the contact person in that role description to your benefit. Give them a call, find out some more information about the job and what kind of support you'll get, because a role description is can be quite broad and not necessarily provide you with the detail that you would get if you actually contact someone and find out what is the job actually about, where are you going to work, what opportunities are you going to have, what support might you be provided with. So certainly don't be afraid to make contact with that person and get any of those questions answered before you actually apply. And I'm sure Kylie's also mentioned around things like having your CV up to date, having all your documents certified by a JP, so that when you get asked for that information, that's ready, having all your immunisations up to date so you can provide that evidence. So certainly being prepared and researching the position that you're going to apply for is definitely a key point to be aware of. That's probably all I had to say, unless there's any questions that people would like to ask.
We actually missed a question earlier this
Oh.
morning, Michelle. I'm not sure how we did that, but we did. We will get back. Melissa, we're actually, in case you're going to look at this again, because this is actually being recorded. Melissa's question was, when you say centralised process, what aspects are considered when recruiting? And then she's got just a question, since I'm not an Australian citizen, also in regard to professional development, in terms of physiotherapy, do we have rotation throughout the hospital that gives a wide area to work in, or do we, the grads, get to choose a particular discipline? So I'll go back to Michelle now to answer those questions.
Okay, so I guess the centralised process just means that rather than each hospital, each health service, so rather than Royal Brisbane having a process, PA, Princess Alexandra having a process, Townsville having a process, they all join forces and they have one big recruitment drive for all the new graduate positions for physiotherapy across the state. As part of that process, the people applying actually get to put in some preferences around, well, I'd really like to work at PA. I'd like to go to not the Children's Hospital, it's not Lady Salento anymore, or Townsville. So they do get to put in preferences, and then applicants are actually, they go through the normal interview process and would be ranked, and then the highest ranking applicant would obviously get to pick from their preferences. So if the highest ranking applicant wants to go to Townsville, then they would get to go to Townsville. If they wanted to go to Royal Brisbane, they'd get to go to Royal Brisbane. And then they work their way down the list depending on how many positions they've got against the applicant. So it's the same recruitment process that would happen, say, for our OT position here in Townsville. We would go out, we would advertise, we would shortlist, we would interview. So the centralised process is the same from that aspect. It's just that it's one process for all the new graduate positions rather than having each health service do their own. So it's pooling of resources, really. What were the other questions, Kylie? Sorry.
No, that's okay. Just a question, since I'm not an Australian citizen.
Yeah. So certainly there are some, you would have to provide visa, any visa, like as part of that, certainly doesn't stop you or inhibit you from applying, but you would need to have evidence of either Australian working rights or a visa that says you can actually work here in Australia as part of that application process. And that's part of the evidence that you would need to provide, that needs to be certified and those kind of things, but that's just part of the process. So certainly non-Australians can apply, it's just some extra steps or extra evidence around being able to work here within Australia. And the one about rotations, yes, so my understanding for the physio rotations here in the hospital, yes, they do, the new graduates do rotate. I think they're about a 4-monthly rotation for physios where they go to different areas. I'm not sure if they have a preference, like in OT, we have a preference system where our rotational staff get to put in preferences. Not that they always get their preference, but we do have a system where we ask them where they'd like to go. So I'm not sure if that happens in physio or whether they have a more structured approach where you might do your musculoskeletal before you do your rehab, before you do, whether they have a more set rotation, but they certainly do have rotations within physio where people get to go to different clinical areas. Yeah.
When you're actually applying for your roles, whether it be via Smart Jobs or whether it be via a centralised portal, there'll be a series of questions. So usually you need to register. One of those questions will be around citizenship, so work rights. So usually I know Smart Jobs is a drop-down box. It'll let you know a series of, you can select your Australian citizen, your Australian resident, are you on a visa? So they really walk you through that process. So it's not so much the application or tell your application, but it's really registering your details so that when you apply for your role or your relevant information is there quite quickly for hiring managers to access.
So do we want to hand over to Morgan or Janet to talk about their experience here as a new graduate, if there are no other questions?
We're going to hand over to Janet. Janet is a occupational therapy graduate, and she can give you a story as to why did she choose occupational therapy as a career choice. She might like to give us a bit of a background as to, you know, did she have a career prior to that coming on board? The good, the bad, and the ugly. We want to hear it all. Thanks, Janet.
Hi everyone, how are you going today? I'm Janet. I'm a new grad occupational therapist. This is my coming into my third year being out. Yes, I did have a career prior to OT. I've been very, very blessed. I have been working for the Townsville Hospital for coming up to 15 years, which has been a long time. I worked as a clinical pharmacy assistant on the rehab ward, which then got me into OT because we were helping patients with retraining of their medications and Webster packs and that. And I found that really, really quite rewarding, actually helping people get back into the community and being able to do all the things that they want to do within their day. And I actually was asked by one of the consultants, had I ever thought about becoming an OT, and I had never thought about it. So she obviously saw something in me that I didn't see, and the rest is history. But in saying that, since coming on, and I did the process through applying for the graduate position, was not successful. So I applied through the pool to become an OT at the Townsville Hospital here. I was lucky enough to be able to get a contract, and then have just been very, very blessed to be able to be backfilling those other contracts within the time period that I've been here. But overall, so far as an OT and as a new grad at the Townsville Hospital, I have felt so well supported within the department. I found that as a new grad, we have access to a lot of invaluable support and resources, which so far has made my experience working here as a clinician really enjoyable one. Regarding to what this support and these resources look like, we have weekly supervision with our senior clinician where I can discuss what's going on with my clinical caseload, how I'm going, prioritising my caseload and my workload, determine my goals that I'm working towards, and discuss professional development opportunities, available courses and workshops, and how that will support me achieve my goals as a clinician. Every week we have an in-service where there is a presentation on a particular topic such as aged care, equipment, cognition, rehab, with the focus of building our knowledge on those particular areas. And once a month in these in-service is also a new grad video conference presentation where all the new grads within Queensland Health can dial in on our Microsoft Teams, and presentations are focused supporting new clinicians working within the Queensland Health. We also have once a month a new grad community practice where all the OT graduate OTs within the Townsville Hospital and Health Service meet up with the clinical educators, support officers. And I found this to be a really, really safe place to be able to discuss anything that I have, any concerns I have, or and it's actually been quite interesting because like once you bring something, you actually find that the other new grads are feeling exactly the same way, so you don't feel so alone, I suppose. And I have found that having the CISOs to go to, they can actually clinically support you as well. So you've got quite a bit of support there. What else do we do? We've got quite a bit going on as new grads. The main topics we focused on included professional development opportunities and how to make the most of supervision, managing conflict, team relationships, and self-care, which was a really big thing. It is also a good opportunity to seek advice from fellow new grads and provide any tips and strategies that they have found useful, and found it normalised a lot of the feelings and struggles that we were having, especially when you're rotating into a new position, because then it's all new again. You have all your new vulnerabilities and things that you think that you're not very good at, but everyone feels the same way when they first rotate. There's also our Allied Health new grad program where all the new grads from various disciplines meet together. This is a great networking and learning opportunity with the other disciplines, and it really sets you up well to work as a multidisciplinary team, and you learn to really work especially when you're going to those settings like rehab or the subacute units where you have to work as an MDT team to actually facilitate and help the patient get back home. We also have access to various of senior clinicians that give us practical guidance on the ward when we haven't had the actual clinical experience, and they have been really great. I found that the vascular and lymphedema and palliative seniors have been so helpful. You know, and it's just a phone call away, and they're happy to come and help and walk you through what processes need to be done. It's been invaluable. So finally, being a part of the OT department, been so lucky to have the access of many helpful resources within our department and have an array of training that I was able to work through and assessment application. As a Queensland Health employee, I have had access to the QEPS, which also, it's the intranet, so you can actually get more learning from learning capabilities, and we also have so many other things that you can look through and work through for within your role. For instance, when I was rotated to paediatrics, they had in the intranet, I was able to go and learn about paediatrics, burns and management and that sort of thing. So overall, I've been very, very blessed. So, and I don't take a day away where I'm not grateful. So I hope that's been helpful, and I hope good luck to everyone out there.
That was awesome, Jen. It was great. And what you got from that message was the ongoing support, that the need to make sure that you're okay, you feel supported. But I really like the story about I wasn't successful through that grad program, but there were other portals for me to come through. So I think out of this today, the grads have been superstars for this, giving us so much information. And we look upon it as this component, but you know, I didn't think about if you didn't get through the grad portal, here's another portal for you to come through. So that was really imperative. So what we're going to do is we've got this phenomenal Morgan, who's a speech pathologist grad, and she's going to give us a little bit of an update as to where she came from, why speech pathology was an area of interest for her, the good, the bad, and ugly on this speech pathology graduate program. Thank you, Morgan.
Thank you. That was very hard to follow, Janet. You did a great job. So, as you said, my name is Morgan. I am a Townsville local, so I went to school here, I went to uni here, and I graduated from JCU, and then started straight into work here. So I chose speech pathology because, well, I had a little niece when I was younger. Well, personally, I always knew that I wanted to get into health, but I did have a little niece when I was younger who needed to see a speech pathologist, and I kind of had that exposure to it, didn't know much about it, and then just went to uni for it. And luckily enough, I fell in love with it, and you know, everything new that I learned from it, I continued to love, and I continued to be interested in it. And it turned out being not what I expected it to be at all, and especially the position that I'm in today, working in the hospital, is not where I thought I would be when I first applied. So it's really funny how it turns out, I guess. So like I said, like I'm a new grad here. I started and I've been here for about 3 months. And I'm one of 3 new grads as well. So there's 2 others that started around the same time as I did. I think it's just the way that the department was going at the moment that they decided to employ 3 new grads, but I think I'm very, very lucky that I was one of them. So the position that I applied for and that I'm employed in is not a new grad specific job. It's just a HP3. But I can't even say that it's just a HP3 because the opportunities are endless when you're in a HP3 job. So particularly I applied to Townsville, but I also applied to Brisbane as well. And Brisbane, they're new grad specific jobs. But the reason why I've actually ended up choosing Townsville over Brisbane is just because I was, you know, I was just informed of all the opportunities that you can get here. So you're not limited in what you can and can't do as a HP3 when you work at the Townsville Hospital. So, for example, you know, within your first year, you can start becoming upskilled in doing video fluoros on your own, and you can start working or looking towards working in a pediatric setting, which in the tertiary hospital can be quite specialised. And then you also just find your niche as you go around in the rotations. So we have 6 monthly rotations, I believe. However, between 3 new grads, we're very lucky that we're going to get micro rotations before we get to the end of the year. So we're going to, you know, have experience in a lot of different areas, you know, in our short time that we're going to be here for, hopefully longer. So one thing that I wanted to touch on that Janet also touched on was supervision. So as she said, we're very, very supported in the hospital, and it's very mirrored in the speech pathology department as well. So I get at least 1 time a week, I get to sit down with the supervisor. So it'll be a senior speech pathologist, and in that kind of supervision session, I just get to touch on a lot of different things. You get to talk to this person in confidence, and you don't, you know, what they say, like there's no such thing as a stupid question, because sometimes I feel like I'm going into a question that I should know from uni. But in these sessions, you know, you get to talk about the possibility of PD, or you get to talk about the possibility of where your next rotation is going to be. You talk about self-care and, you know, reducing burnout as you need to. And you also just get to ask a few clinical questions as well. So if you're on the ward and you don't know what's happening, you're not expected to know what's happening because you're a new grad, the opportunity for support, the opportunity for shadowing, the opportunity to get stepped through everything that you need to do is there. And it doesn't have to be during that specified time of the session. It can, you know, just be through a phone call, and then suddenly their time is yours. I also take part in the allied health education sessions, which have been really, really good. So obviously JCU does its best to integrate multidisciplinary kind of exposure within all the years that you're at uni when you do, you know, the multidisciplinary subjects. However, I think it's not too different, but it is definitely a step up when you get to a real working environment and suddenly you're on the medical wards and you don't know any of the occupational therapists or what they do. That's when these sessions come in handy. You learn about what everyone does, you learn about roles in different case studies, and, you know, you also just know someone's face as well, which can be really, really nice. The last thing that I'm going to touch on is like placements. So obviously the Townsville Hospital and JCU have quite a close relationship. My clinical educator is also your clinical educator, which is really, really great. So it makes that transition from uni into work in the Townsville Hospital very, very seamless and very easy, because you're seeing the same people that you already know from uni. And I was very, very lucky that I actually had a placement here in my 4th year. So then I actually got to build relationships with these people and really got to figure out what it is like to work in the hospital. And one thing that I just want to say is, you know, I know that in speech pathology specifically, a lot of people, you know, they want to go to Mount Isa or they want to go to Darwin or something like that, but don't be afraid to put Townsville down as one of your preferences. I think it's worked out really, really quite well for me in the fact that I already knew everyone that was here. I already knew all the processes that we do in the speech pathology department. And it just, you know, made that transition very, very seamless, especially because I was interested in working here. And everyone knew my face as well. So it just makes it very, very easy to just come in and be part of the team. You know, I've been here for 3 months and, you know, I am very, very happy to come to work every single day. There's not a day goes by where I don't want to come to work. So yeah, that's all from me.
So Sandra, this is Sandra, the other lovely lady who's the facilitator today. We want to thank Morgan and Janet for their time. What we're going to do is Sandra's just going to finish off. I can see there's no questions have come through, and we'll wrap up our sessions for today. So thank you for your attendance.
Again, like Kylie said, thank you so much for attending the JCU 2021 Virtual Careers Fair. We've loved participating as the representatives from our Townsville Hospital and Health Service, and we hope you've enjoyed the day, and we look forward to seeing you all again next year. Thank you so much.